Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair loss, or insulin resistance, you might be dealing with PCOS, or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created OVI, a science-backed alternative to prescription medications. OVI is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. OVI offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to OVI.com. That's OVII.com and start today.
Well, I am thrilled to have Mayan Lopez sitting across from me, this vision in Burgundy. And I have to say that we might be cutting this short because Dr. A just told me that she has a patient in labor. And
I think she's going to behave. I think she's going to behave.
Yeah, so hi, everyone. I'm Mayan Lopez. I'm currently on a show that I helped co-create actually from a TikTok. It's the first show to ever come from a TikTok.
Really?
Yes.
The show is a lot about your real relationship with your dad, and you guys were estranged for a bit, and then got back together. And you, at the time, growing up with this very well-known comedian, kind of walk us through that.
Oh, well, I've developed a very thick skin very early, and I like to joke in a way it was Lopez versus Lopez because we've always had humor, and I think being raised by a comedian, sometimes we would communicate through jokes, and I love that. I like to say that we revisit our time and we don't relive it, but I think the best art comes from truth, and that's what I love about our show is that, like, yes, we can make you laugh, but there's also those really real moments that you can't fabricate. Like, we're really going there, and I think that's what's so wonderful about a sitcom too, because it's just capturing life moments.
Is the show about the two of you?
Yes. My character's name is Mayan, but I call her Shmayan, sitcom Mayan, or else it just gets really confusing. But yes, I'm a TV mom, and so I have a son and now a fiance. I'm single in real life. But
I was going to say, you don't have a son.
No.
You would know.
You would have delivered him. It's like, you would have delivered him.
How old were you when you guys decided to do the show together? And were you estranged when you decided to do the show together? Did it bring you together?
We weren't in like regular contact, no. It was in 2020, so it was really the pandemic that brought us together. And it was really the first time my family were together in 10 years because I was kind of in the middle and, mediating through a very contentious divorce. But I think the show kind of came from that and the content that I had made because I was studying comedy and I went home, and social media was a way to reach out to the world and a way that I was able to create and find humor and try to connect in a time when it was so uncertain.
And I think, using social media for good, it's so often we see and hear, it's terrible for you, but that's a really good example of you being able to use your platform and reach, a lot of young people who were probably dealing with the same thing and thinking that they're alone. And did that happen?
Yes, and I think also from being in a celebrity family, I think sometimes behind a headline, there's a family that's falling apart and that is struggling. And I think we sometimes forget that, people ask me, oh, is it like having your dad as a celebrity? I'm like, I like to think my dad is just really good at his job and people know him for being good at his job.
Right.
We're all just people, and we all go through the same issues. And I think sometimes when, that person's going through that, I'm being seen, my issues like I want to talk about like my PCOS today. And like, that's something like, oh, she goes through that. I go through that. It's all about trying to connect and feeling like you're being seen and your story's being told.
Do you think that the show has been healing for you guys?
Yes.
Yes, amazing.
Yes, it has. But it hasn't been easy at all.
Do you guys write it together?
We do. We have a wonderful cast of writers, but we do take stories that are from our real life. And
Did your dad see your TikTok and then he thought, oh, hey, how did that happen?
Yeah, he did. ironic. It's funny because I made a whole series of why do my divorced parents still act like they're married? Because even though they were divorced, they were together for 20 years. You know, my mom was trying to like pop a zit on my dad's nose. And, you know, I just thought it was funny. So I just started filming, you know, as we do. And the first one that actually got the show started, I was twerking upside down and making a duet. I know. It's like, love my legacy. But I was commenting because someone made a TikTok talking about, because my mom gave my dad a kidney almost 20 years ago. And and then my dad was unfaithful, cheated on my mom. And it was
after the kidney.
Yeah, after the kidney. And so it just followed my family. And someone made a TikTok about it and I got tagged in it. And I've kept quiet. And I was like, you know what? I have a good feeling about it. Let me make something. Who's going to see it? The right person. And but I was like, you know what? What's going to get people's attention? I don't know. I'm a comedian. I'll twerk upside down. I don't know. I don't feel afraid of being stupid. So I like put text bubbles and I was like, she still gets hella alimony, you know, she's better off. And our showrunner was scrolling at like 2 a.m. and I came up on her For You page and then she kind of got in contact with us and the show was born from that.
How many years ago?
4.
Wow.
Almost 4.
Well, can we talk about your health journey?
Yes.
So when did you sort of feel like something's wrong?
I got my period when I was 11. I just thought being Latina, I was like, oh, I have excess facial hair, you know. And then as I started going into college, I gained 75 pounds in 3 months.
In 3 months?
And there was no explanation for it. And I went to the doctor and they were just like, oh, you've had irregular periods. Like, just try to do on birth control. Try to eat better, exercise. But I was working out 2 times a day, sometimes eating really well. My weight wouldn't budge, which just puts another shame that you have as, you know, a woman. And I was in a relationship at the time and I felt really self-conscious and I was also performing and I just would look at myself and it was just self-hate, like just self-hatred. And I was already just always self-conscious. I was 22, 21, 22. And, you know, that's a time where you're trying to explore. And I just like became a shut-in. I got really, really depressed and really upset. And I didn't know why. I actually lived in Chicago at the time. And I was thinking of going and getting bariatric surgery because I thought, you know, I will say that, you know, trigger word, I have struggled with disordered eating. And I thought, you know, maybe it's that. And maybe I'm not doing enough. And then a doctor was like, you know what, maybe you go, my internist was like, go to an endocrinologist. So I went and I was 22 years old and I got my lab results back and they said, look, I don't recommend that you do this, but you're almost metabolically in menopause. Like you could have sex without protection. You wouldn't get pregnant like at 22. So he was like, you know what, try to go to Dr. Aliabadi. You know, she's very busy, but I was like, okay. And so, you know, I called your office and I sent my lab records and they called me immediately back and they're like, how old are you? And I go, 22. They're like, you're coming in immediately. They're like, you're coming in. And you were the first person to tell me that I had PCOS. And it just changed my whole life, especially insulin resistant. I had no idea what that meant or what that was.
I still remember when I told you, I don't know if you remember this. I remember which room you were sitting at when I told you this. Yeah. I remember one of the things you told me is I feel validated because I feel like she had been dismissed. And, you know, she walked in with every single symptom of polycystic ovarian syndrome. She wasn't missing a single symptom.
What can I say? I'm an overachiever.
You definitely are. And PCOS. She had irregular periods, right? She had acne. She had facial hair, body hair. I don't remember about hair loss.
No, I didn't have hair loss.
You were anxious. You had gained weight. She had disordered eating. Like she checked every single box of someone who would have, you know, with PCOS. And it was, you know, I always say this until I started this podcast. I always say, you know, I tell people you don't understand what I see during the day because it's really devastating. If you spend a day with me in my office, you understand what I'm talking about. But now I feel like people are getting a glimpse of what really happens in my office. She's not the only person. She's someone with a platform, with a voice, with access, and she was still dismissed, not treated. She was very overweight when I saw her. And what happens at that age? You start losing your self-esteem.
Oh, I mean, even in the first season of the show, I've lost 40 pounds like, on camera. And I think I was just starting with you. And people would say, oh, you look so much better on camera now, to me. And it's just like
adding insult.
Yeah. I struggled with binge eating during my parents' divorce. I think that was food was something that I could control. Mm-hmm. And when my world was really falling apart, and it was just a really great comfort, and it was there for me. And then as I got older with binging, I would go with restriction, purging. It would kind of evolve with just how I was feeling, because there are years of my life where I just don't remember because I was just so depressed. And even my time in Chicago, that was when I was struggling with a lot of my weight issues, and I would be inside like a lot. And, I have wonderful friends there, but I don't have a lot of memories because I realized I only went out to perform, and then I would go back into my apartment because I wanted the least amount of exposure as possible. And, even my boyfriend at the time, he'd be like, oh, are you not excited? And I'm like, no, my body, I don't know what's going on. And because there's other things that happen when you have PCOS. It's like your body doesn't understand.
Right. We always talk about all these young girls who with eating disorders, mm-hmm. right? With an underlying condition that's dismissed. Our mission with this podcast is, I'm not saying every single person with an eating disorder has PCOS.
Right. No.
But you, as a clinician, as a pediatrician, as a primary care provider, as a gynecologist, you better make sure they don't have insulin resistance. Right. I mean, how many times have you heard from our patients? Oh. They say, I cannot possibly eat less and exercise more. It's not sustainable.
No.
And they still don't lose the weight. And when you said they compared you to a menopausal woman, because you were almost pre-diabetic, you had gained a lot of weight, cholesterol. I mean, all of it gets affected.
I've lost 100 pounds.
So can you walk us through her treatment plan then?
So this is not something that suddenly happens. Patients with PCOS usually have family history of diabetes, insulin resistance, overweight family members. And a lot of times you don't know, like I'm insulin resistance, right? I gained 60 pounds with my pregnancy because I let go of my diet. If I let go of my diet, I'll sit here in 2 months, 50 pounds heavier. That's what happens with insulin resistance. So it's extremely common. But what happened with her, for me, when I see young patients with PCOS who are overweight, the number one thing to fix is their self-esteem. That's the first thing I aim, because self-confidence and self-esteem is a must in life for women. Without it, you can't function. You can't get to where you want in life. You can't find a good partner. You have to believe yourself. You have to like yourself. You have to love yourself. You have to feel good in your body. And has nothing to do with looks and beauty. It's just the way you feel about yourself.
You described
She was just sad. She was just broken. She was defeated. Defeated is the word I would use.
Like if I could have walked away from myself, I would. That was like where
she was devastated when I diagnosed her. Devastated.
So she walks in, and what's the treatment?
I always say to diagnose PCOS, you need 2 out of 3 criteria. Mm-hmm. She already had 2 of the criteria. The first criteria is irregular period, mm-hmm. which she had irregular mm-hmm. periods. And number 2 was elevated testosterone symptoms. Well, she had all of it. Facial hair, body hair, acne. Mm-hmm. She was already on spironolactone when I saw her. And the third criteria is PCOS looking ovaries on ultrasound. Polycystic doesn't mean cyst. It means these women have a lot of follicles, a lot of eggs. It's a specific finding on ultrasound, and she had that too. So she had 3 out of 3. PCOS patients tend to be anxious. She was anxious. I don't know if PCOS causes anxiety or anxiety is part of PCOS, but you see a lot of mood disorders with PCOS patients. Family history of diabetes and overweight family members. She had gained all the weight. So, and she was really upset.
Like I would eat something and I would work out, and the calories, like it wouldn't burn, it wouldn't move because my body just wouldn't like process sugar or anything properly.
When I met her, she was 23. It was in 2019. She came to my office. She was, or her endocrinologist, right before referring her to me, had started her on Trulicity. Remember, I told you in 2014 I used Trulicity for weight loss. Well, when she came in by 2019, we already had better medications. So I switched her to Ozempic because my mission was to just drop her weight and make her feel a little bit better about herself. I was worried about her disordered eating because that comes. And I just want to make this clear. Every single woman on this planet would have had disordered eating or an eating disorder if their PCOS and insulin resistance would get dismissed the way hers was.
Oh, it was years.
Years, right?
Years.
So I switched her from Trulicity to Ozempic. I started her at that time on metformin. And over time, I think I switched her from Ozempic to Zepbound.
Yeah.
And I increased her dose of metformin. I maximized her dose of spironolactone. But at the end of the day, you have to fix the hormones inside. You have to deal with the insulin resistance. You have to deal with the testosterone levels, the androgen levels, to have someone sit across from you 5 years later.
And what's fixing that? All of those together?
All of those. Spironolactone helps with the hair loss and the acne. It can help with facial hair and body hair. Metformin helps with insulin resistance, sustaining the weight. The Ozempic and the Zepbound that she was on helped her with regulating her insulin, controlling her appetite, controlling the binge eating. And one thing I've noticed with these patients, as they lose their weight, their periods become more regular. I started her on birth control pill to regulate. So
sometimes I wouldn't get my period for months even.
Yeah. So I basically treated everything because she was a poster child for PCOS.
Bing.
How soon until you started to feel better?
Oh, I think I lost 10 pounds in almost 2 weeks. Like it was immediately. And I think even just leaving your office, I just started crying because I was just like, finally, I have someone listen to me and someone like saw me and I have the answers, and that at least it'll help on my journey of like finding my self-esteem and finding myself again, because I'd lost her many, many years ago. And that was something that it was a relief. And, I knew there was going to be, work to be done. It's not a magic pill. I qualified for it. And, no, it just helped give me the confidence that I needed, and also feeling comfortable in my body again. Like, oh, we can figure out how to work together.
Your body starts working with you, not against you.
I don't have to be mad at you anymore. Because, it's like I'm with you every day. I'm with, it's like the longest really. It's always going to be me. You're always with yourself. So,
and you just got OB.
I did just get OB.
And I was going to say, for anyone who's listening to this show, if you have irregular period, acne, hair loss, facial hair, body hair, you're gaining weight, you have anxiety, you have hard time losing your weight, you can go on OVII.com, OV.com, and we have a risk assessment test that we ask questions.
Again, checked every box.
You would have. Yeah, you would have graduated with stars. Ding. But obviously we can't diagnose people online, but we can tell them whether or not they have the likelihood of having PCOS. And, we have this amazing supplement, OV supplement, that addresses a lot of the symptoms of PCOS, and it'll be a game changer. So I can't wait for you to try it.
Yeah,
let me know what you think.
I was like, I have my annual with you in a couple months. So I'll be able to tell you. I was like, I didn't even tell you.
We're gonna follow you, and then you're gonna tell us.
And I'm gonna
but
post
it
about
needs 3 to 4 months, just like metformin, to really kick in. But just make sure you take it with the heaviest meal of your day.
Okay,
because it helps with regulating the sugar.
Okay, perfect.
I always say in life, and I say this to my daughters, and you've heard it, I say, especially for women, you need 3 things in life to succeed. You need confidence, resilience, and effort. You need all 3. You don't have to be rich. You don't have to have money. You don't have to be beautiful. You don't have to have anything else. You need confidence, resilience, and effort. If you have confidence and resilience, you don't put any effort, it's going to be hard to reach your goals. Yep. If you have confidence and effort, you don't have resilience, you go down, you don't come back up, you don't get to your goal. But if you have resilience and effort and you lack confidence, it's going to be hard. It's going to be hard to do things in life. So confidence, and I always tell my children, self-reflect and see which one you're missing. Is it effort? Is it resilience? Or is it confidence? Whatever it is, deal with it because you need all three.
Yeah.
That's the Aliabadi rule for
Yes,
success.
exactly.
And so that's why confidence is so important for me in my
And
practice.
if you have to pretend to be that person until you are that person.
Yeah. Fake it till you make it.
Fake it. But also, yes, resilience. And if you need to be down, allow yourself to be down. But,
you need to
get
get
back up and don't stay there.
What do you think the biggest change has been since you've gotten control of your body and just regulated?
Look at her hair.
I know.
Look at her skin. There's no acne. Look at the way you carry yourself. That's confidence. That's confidence. It has nothing to do. Every time I say that, people get it confused with beauty. It's not beauty. It's that confidence,
it's the inner oomph.
Yes.
It is. And that's what matters. There are a lot of beautiful people who walk around and they have no confidence.
So when I hear your story talk about this, it breaks my heart. It breaks my heart for that little girl who had everything to look forward to. You were living your dream. You were in Chicago. You were, you're a comedian. You were doing all of these amazing things. And yet you were just so broken. And to be able to know, and again, why we started this podcast, to be able to know that there are solutions and that there is a reason that it isn't you, that it's really, it's PCOS. It's an actual diagnosis that is the reason that your body is not behaving the way it should behave. And I think having that just is amazing.
Yeah. And I still have to regularly check up on my hormones too, because sometimes, I'll fluctuate 10 pounds, 5 pounds, with my hormones or.
Of course, age affects it, her diet, her exercise, her stress levels. So one thing I do with her, not only I monitor her hormones, now that she's all done, she comes to me just once a year. So I don't really need to see her that often, but I do check her hormones, make sure everything's regulated. And the other thing that she'll talk about is I check an egg count on every single PCOS patient who walks into my office. Because as you know, PCOS patients have tons of eggs, but the quality can go down. And I'm on Mayan to freeze eggs. So one of these days I'm going to...
I know, you're like, I want to deliver that baby. I'm like, I'm trying. Yeah, no, I do. I'm hope to do it in the new year when I'm not working.
Can we also talk about your lifetime risk or no? Of breast cancer and genetic testing in your family history? Do you want to talk about that?
Yeah, my great-grandmother had ovarian cancer.
I think when I met her, because of the family history of ovarian cancer, we did the Myers genetic test on her. She doesn't have any gene mutations, but because of her family history, at the time, we have to recalculate your lifetime risk. Because when I met her, her weight was so high that pushes your lifetime risk up. At that point, her lifetime risk of breast cancer was 24%. She did feel something in her breast. It turned out not to be anything at her age. It usually isn't, but just because you can't say, because you're 23, I'm not going to work up your, breast lump. She had her ultrasound, everything was fine. But we have to recalculate your lifetime risk because now that you've dropped all this weight, that number can change. If your lifetime risk stays above 20% or above, then you have to go for breast imaging starting 30. You're not there yet.
You're not there yet.
Well, I'm 28. So.
Yeah.
You're such a baby.
I'm just a baby.
So tell us what. So the
trauma makes me like 33. So.
Not at all. But you're so mature.
No, but let's talk
lived a
about
lot of
that. I
life.
think that, you are somebody that has had some trauma in your life and exactly what we said, like resilience. You picked yourself up. How do you think that you did that?
I've been diagnosed with complex PTSD, which I think is just normally, it's sometimes the same situation happening over and over and over again. And I've been disappointed a lot in my life. I think having an absent parent, I think I have the argument that I've been loved too much. I will say, I had a parent that wasn't there and a parent that had to overcompensate. And so my mom, she's a superhero. She was mom and dad for me, but my dad was not really there. The only thing that he could give me a lot of the time was just his status, money, which is still providing, but I had to make the way. And also with my weight, as I started, it does a lot to your self-esteem when no boys like you. I went through Also being in LA and growing up here, and there's the really skinny girls, and I was, this is early before being curvy and plus size was
A thing.
a thing. And I feel like I've been like 15 different versions of myself and just had to face a lot of darkness and grow up very quickly. Especially since divorce is hard, but it being so public.
Right.
I once had a teacher ask me, like, is it true that my dad cheated?
A teacher?
Yeah, a teacher. And
How old were you when that happened?
15.
Oh
15,
my
16.
goodness. These
And
people.
it's just at like it's such a pivotal age.
And you still remember it.
Oh.
You see?
Yeah. And so it was just, I was so depressed.
How did your mom know that you needed help?
My mom read my diary. And I had been very honest in there. And, as a teenager, it's like, Mom, get out of my room. But it's like, no, there is a lot of, it's sometimes where if your parent, don't get mad at your parent, they do care. And that act like saved me because I didn't go by choice, but
And obviously she must have known. Like we have a sixth sense as a parent where like something is wrong and you have to get to the bottom of it however you possibly can.
No, and like thank God for my mom.
Yeah.
And you were saying how you did not grow up with your father and you only had your mom. And I always say this to my patients and my friends.
Oh, come on,
Mommy.
This is a mom.
Okay.
This is what you do. You have to fight fight
Yes.
for those babies.
And I always say, love you. You need one good parent like her to raise an amazing daughter like you. And that's the reality
if you don't
of it.
try to be the woman that you or the parent that you would have wanted for yourself.
Yeah.
And because you
bravo.
can give that self love.
That's actually a great point. If you are listening and you don't have that one parent, try to find a friend, try to find someone in your life and try to be that for yourself.
Because even through the show, I'll add just a little, it's quick. But through this show, I play a fictionalized version of myself, but I'm going through real things that have happened. And so like there's this little girl, like I had to unfortunately kind of tell that little girl that always had hope because I thought during the show, oh, well, my dad's doing it with me and we're talking about these things, so he'll really get it this time. And that wasn't the case. And so it was almost mourning again that I wasn't going to have the father that, I've accepted the relationship. And I think that's also a thing that takes a lot of strength is to realize when to drop it. And it's not defeat, it's acceptance, which I think is equally as hard. It's actually one of the strongest things that you can do for yourself. It takes more energy to hold anger. And Rita Moreno was on our show, and one thing that she told me, because I was drowning, she was saying, tell that little girl, like you're safe, don't have that voice in there, like you're safe, I'll take care of you. And she told me, at 92 years old, I still have that little girl. There's still that little voice that's, saying you're not good enough and this at 92 years old. And hearing that almost was like, oh, so I don't have to get rid of her. I just have to like take care of her. And that's like, I'm actually in the place where I get to like hold her and hug her and I get to
take care of her.
You take care of her. It's not just a little girl. It's like, I think a 15-year-old me. There's the different parts of yourself that will come out in certain situations. And, they got you through. You've survived 100% of your worst days. Like every moment that you didn't think you're going to get through it, you're here. So you can do it.
So what advice would you give to a young person listening now who's in trauma and thinks that there is no way out? And we have such a crisis in this country right now with depression and anxiety. I get chills even talking about it. What advice would you have?
Like that there is always someone that will listen to you. I will say that when I was 15 years old, I went to a residential treatment center for a year and a half. So I was there and I was around 16 to 17. Wow. And that saved my life. It was the first time that I got to be away from my parents. And I realized that it may have been your parents' mistake, but it's your responsibility and it's your life. And in things you don't live life for them, you have to live life for yourself. And you have to, I always used to thank the pain because the pain served a purpose for me in life. And I don't say that it's not a horrible thing to do if that's what pushes you. But loving myself through, and this has taken, granted, like over 10 years, but loving myself through it, you have to be your own cheerleader. And I think always going through, I always had a voice telling me that you were meant for more and this is not like the end for you. And I think just trusting, handing it over.
How did you ask for help?
I had a team of wonderful therapists. I actually dedicated an episode of my show to my therapist who passed away of stage 4 colon cancer. And she found out when she was pregnant with her third child.
Oh my goodness.
And that woman like is the bedrock of like who I am. And so it's like you take that one person that helps you and now you look at me and like here I am, because of that one person. It's like the ripple effect. You never know how someone is going to affect you. And I had such wonderful people. No, that facility like really, it created a safe space for me. And I think also an outlet was theater and comedy and just finding somewhere that you can be yourself, just a little something that's for you.
So you were at the facility for
Depression. Yes.
Trauma, PTSD,
Yeah,
depression.
it was just so much and I didn't know how to handle it. It saved my life. It was, either this or it was going to be a very different result.
I just thank you so much for being so honest and vulnerable. I mean, I get like, I just look at you and I see this confident, beautiful. You walked in this door and you were just this light.
I want to add one thing. You still look as gorgeous as the day I met you. The one thing that's different in you is that confidence. That's what makes you look so stunning, like a ray of light when you come in, because you found your confidence. And I'm so proud of you for that.
Thank you. Thank you for saying that. Yeah, I always found myself to be like beautiful, but no, I didn't. I was like, that would be wrong. I think I knew that like there was that person in there, but I never thought I would be her. And now I get to be her and to evolve. And I think sometimes in life, even where I am now, I didn't think that I would get this far at one point in my life. And so everything is just, I've like faced a lot of hard now. I hope to, enjoy, and there will be hard moments, but I think that's one of my purposes here is that I went through a lot of hard and I want to help and be of service.
I honestly, this is so amazing. I can't thank you enough for being here today.
No, thank you.
Before we close, what are you excited about? What's next?
Yeah, we're in the 3rd season. We're now on NBC on Fridays at 8:30 and going into a third.
It.
Yes,
She doesn't watch
It's on Peacock.
anything.
I don't watch anything.
The first
but I'm
2
gonna watch
seasons are
this.
on Netflix. Yes, and just enjoying that. I'm a co-creator and I produce and I help write on that as well. If you were a Drag Race fan, I was a judge on season 16 of RuPaul's Drag Race, and which is one of my crowning achievements. And I'm just being mine. You can check me out on social media.
And what's your social media?
At Mayan Lopez.
At MayanLopez.com.
You're an incredible
Amazing.
human.
Oh,
Thank you for using your platform, for talking about PCOS. There's so many little girls who are suffering and have your symptoms and they're lost and they're being dismissed. So we both really appreciate you.
No, I
doing
thank you for
this.
being here because it's something that I've wanted to talk about for a very long time, but I never really knew how.
Mayan, thank you so much for sharing your story and being on the show. This is such a powerful episode, and we just feel so honored and grateful that you trusted us to have this conversation.
No, and thank you for being so open. Thank you for having me here.
Oh, we love you.
And thank you for listening.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.